Today we're going to be doing a mid-face suture suspension for my beautiful patient, and suture suspension is an amazing technique for creating lift without structure, and it's an intermediate technique that will give you a little bit more lift than is capable of being achieved with injectables alone, but not quite as much as a surgery. So this is a perfect technique for someone like my beautiful patient who already has nice bone structure and has minimal laxity, where we really just want to elevate the position of the malar eminence and malar fat pad. So suture suspension uses a tiny little needle prick insertion site, and we're going to deliver surgical suture made out of polydioxanone into the deep tissue plane. A little pressure right here. And these sutures contain perpendicularly oriented rasps on them that gain purchase in the tissue. As we pull and resuspend them, we're able to, along a customized vector of pull, create a beautiful lift in this area. So there's a little bit of pressure going in, but it's relatively tolerable. She's been numbed with lidocaine. And now we're going to create a lift and pull. This technique is beautiful because it's a way for us to create collagen induction over time. So over the course of a year, these sutures will dissolve and disintegrate, and they will be replaced by the body's own collagen in the meantime. So it's almost like ivy growing into a lattice in a garden, where over the course of a year there's no more lattice and only ivy. And you can see here, if you look at the lid cheek junction, a beautiful improvement in position of the malar eminence and a nice angled zygoma. Suture suspension can be done in the mid-face where we're doing it now. It can also be done in the jowl, the brow, and the neck. So those are the four most commonly used areas for this technique, because these are the areas, the brow, the mid-face, the jowl, and the neck, where we see most signs of tissue descent that can be helpfully addressed in this way. So you might be a candidate for suture suspension if you're somebody who's thinking about a little bit more lift than you're getting from injectables alone, and you're someone who's not quite ready for a surgery. And so here we're using the perpendicularly oriented rasps on the sutures to gain purchase in the tissue and get that nice pleasing lift of the midface. These sutures are being placed in the deep plane of the face, which is the plane that we dissect in surgery, and that allows us to avoid problems associated with old generations of thread lifting, because we are deep and not superficial, so that allows us to avoid extrusion, rippling, and irregularity. And so if we look at her afterward, that's a nice, beautiful lid cheek junction, pretty lifted malar eminence, nice defined zygoma. And if you look at the 3/4 view, you see this beautiful S shape, which is the OG curve, or the hallmark of a youthful female face.